All right, this is going to be a quick video on how to enter referrals. This is one of the common ways first year interns get tripped up. So start with your assessment. This is the diagnosis you're going to be using for the referral. Go to treatment. Under treatment, right here you click referral. When you click referral, every referral has three things. There's three components to every single referral. First is going to be a provider, which you can find here. If you know the name of the provider, you would put it in this spot. So if it's someone that you work with in the hospital or someone that you work with closely on a regular basis, put it in that spot. Let's put my name here. The format's going to be last name, comma, first name. You select one. You'll see that there's two selections here for my name. Frequently, what I do is I look for the one that has the most information on it, and if it says P2P, which means peer-to-peer. But realistically, as long as you see the doctor's name, address, and phone number here, you can select either one. So you're going to select the name. Okay, so first part of the referral, part one, physician, specialty, name of the provider, it goes here. Part two, if you click these three dots, evaluate and treat. That simple on part two. Some folks like to put, instead of evaluate and treat, they like to just type in the word consult. That's also appropriate. It doesn't have to be a long description here into the reason. It can just be consult or evaluate and treat. If you're looking at notes that I do, frequently I'm in a hurry, so I type eval and it comes up. Select evaluate and treat, and it automatically enters it right here. And then the third part and the last part is you have to have an associated diagnosis. So I'm going to show you if I enter this referral without a diagnosis and it goes onto the note, it goes under other. You'll see it shows it down here, treatment others, referral. It's not what we want to happen. We want it to be associated with the diagnosis that we're referring them for. In this case, it's GERD, gastroesophageal reflux disease. So hit add diagnosis. You can select it either here under the patient's previous diagnosis, or if it's on the patient problem list. This is a blank chart, so we're going to just select it from the previous diagnosis I've already entered. Or if you don't have it under previous diagnosis, just type in gastroesophageal and it'll come up. So you can click it from here. GERD, gastroesophageal reflux disease. I'm just going to put unspecified. And now we have a diagnosis code. If you hit OK, you'll see that all three parts of the referral are now entered. The physician we're referring it to, evaluate and treat, or consult, and the diagnosis code you were referring them. All of these referrals will be assigned to a referral nurse here. Most commonly, what you should see in this assign box is Friedel Michelle. That's our current referral nurse. There's also a secondary referral nurse that helps her, but most of these will go into her box, and that's where they go to look for these referrals. So it'll say assigned to Friedel Michelle. When you're done, you click OK. Click OK, you'll see that the referral now appears under the diagnosis. So there's the assessment, treatment, gastroesophageal reflux disease. There's the referral underneath it. What you don't click is send. Send will be handled by the referral nurse. So once you've entered the referral in, just click OK. Make sure it went into your note. And if you did it, you'll see the referral right under the assessment. This is very simple. Should be a very quick process, but I see a lot of PGY1 get stumbled when they come back to clinic. And how do I put in a referral? I can't remember how to put a referral. It's only three components. Referring provider, evaluate and treat, and the diagnosis code. 1, 2, 3. If you don't know the name of a provider to refer them to, typically I'd say ask your faculty, but you can also just leave it blank because Michelle knows, the referral nurse knows. So if you're not sure, let's see if I can take my name off here. If you're not sure, you can leave it blank. Just make sure and put the specialty. So you don't know a specific GI doctor you want to use. Then go down here and select gastroenterology. When you enter the referral, it's just going to say referral to gastroenterology, evaluate and treat. It's going to say status open because Michelle hasn't sent the referral yet. So when you open it, you can leave it blank. That's perfectly acceptable. The referral nurse will assign it to a provider. That's it for referrals. Thanks for watching.